This is Bruce Jansen at the Hawaii Dermatology Seminar, where I'm speaking with acne superstar Dr. Hilary Baldwin, who has been making some really very telling points about a subject you just don't hear very much about, which is treating acne during lactation. Tell us, please, more.
Well, I think it's an issue that we, as you say, we don't talk about very much, and I think part of it is because lactation is a short duration, and it's a personal choice in ways. So I think often doctors just say, well, I'll wait until she finishes breastfeeding, and then we'll go ahead and treat her acne. I think it's more of a medical legal concern, frankly, than it is an actual medical concern. The interesting thing is I think that most of us were trained that if a drug is not safe during pregnancy, then of course it's not safe during lactation, and that simply isn't true. Exposure to drug during pregnancy is 5 to 10-fold higher, and in lactation you're really relatively safe. Even if the drug does get into the breast milk, the level that the baby gets is less than 10% of what the maternal dose was. So it's actually, the exposure overall is extremely low, and I'm not sure that waiting until lactation is finished is an appropriate thing to do, because we know that depression, homicidal thoughts, suicidal thoughts are actually quite common in the postpartum period. We know that acne causes depression, and what if not treating her acne was the tipping point for this poor woman who was very depressed? And treating her, therefore, would be actually safer for both the mother and for the baby than not treating her. We're trying to first do no harm, and in lactation I think it's possible that first do no harm means treat it aggressively.
What are your go-to drugs in that situation?
Well, the interesting thing that I didn't know about until I started researching this topic is that the presence of drug in the breast milk is actually usually a passive concentration gradient. So mom takes the drug, her blood level goes up, and it flows downhill into the breast milk. If you wait long enough and the maternal blood level goes down, it flows downhill back into the mother again. So it's entirely possible that there will be no drug in the breast milk by the time the baby feeds. So the safest thing to do with any drug that you're using is to feed the baby, take the medication after you've fed the baby, before the longest sleep pattern of the baby, usually in the evening. 11 o'clock at night, baby's going down for the longest sleep period. Breastfeed the baby, then take your medications, and then by the time the baby wakes up the next time, it will have been enough time for the blood level to go down and then flow back into the mother again, leaving the breast milk relatively free of drugs. So first thing is the technique of doing it right before the longest sleep period of the baby. The second thing is that virtually all topically applied medications, acne medications, are safe. We have antibiotics that you can use: Bactrim, penicillin, cephalosporins, and tetracycline, because as we know, tetracycline plus milk leads to non-bioavailability. It's a problem in adults, and it's a benefit for the baby, because if the tetracycline gets into the milk, the baby's eating milk and tetracycline at the same time and is not absorbing it. Turns out minocycline and doxycycline are not safe during pregnancy. Metformin treats acne well and is safe in lactation, and is safe in lactation. The progestin-only birth control pills are safe during lactation, and of course laser and light. Combination birth control pills are generally not recommended during lactation, not because, though, that they're dangerous to the infant. The issue is that estrogen will decrease breast milk production. So studies have shown that women who are on combination birth control pills often need to use supplemental feed. So it's not actually dangerous.
So do you have a first-line therapy, or what do you make available a range of choices?
Well, it depends on how severe the acne is. I personally believe that topical dapsone, topical retinoids, benzoyl peroxide, clindamycin, topically applied, are completely safe during pregnancy, lactation, I'm sorry. So if it's relatively mild or moderate, I'll go with the topicals first, because the orals are always more of a problem. And then I suppose if I had to, my next choice would be metformin, progestin-only birth control pills, but also Bactrim after the first 2 months of life is perfectly safe.